Hi everyone, I greet you all. Welcome to my YouTube channel on this special Monday. And thank you for encouraging and supporting my YouTube channel. I am here today to speak about a great topic which is related to everybody. I mean related to every human. But first, I would like to ask you one question. Whenever you hear about hospital, what used to come in your mind? Medical practitioners, patient, or the buildings? Those are the components of the hospitals. So what's supposed to come in our mind whenever we hear about hospital is patient rights. Patient right is a legal and ethical relationship between patients and medical practitioners, or between patients and medical practitioners and patient relatives. Many times, patients are denied their right in a hospital. And mostly this is the reasons most of the patients doesn't want to go to hospital. They take their own self-medications. And many times, because of denial of the patient right, the recovery of the patients used to be low or used to be in the form that they are not well recovered because they denied some right. There is so many patient rights which we are supposed to know by the patients, by the patients, and by the medical practitioners. And there has to be followed. And mostly, it's supposed to be tested in every hospital as a patient will be. But the patients doesn't care. Or I can say the patient doesn't know even there is a patient right tested in a hospital. And the medical practitioners knows about it, but sometimes they ignore to follow the patient right. So I would like to speak about some of the patient rights today. And they are very important for the medical practitioners and for patients and patient itself. We have to make sure right drugs has been given to the right patients at the right time, within the right dose, in a right dose, from the or by the right medical practitioner. So when we say right patients, is a patient who came to the hospital, not the patient who stay in his room and call the medical practitioner. Is a patient who go to the hospital and register himself in the hospital, take all requirement investigations and see a doctor, buy his medicines. This is what we call a right patient. So firstly, the patient must be right. This being a right, it is among the right of the patients. And we have to make sure the drugs to be given to the patients are the right drugs for his own ailment. Do not forget about the dosage. What are the dosage of that patients? Because the pharmacological actions depends on the dosage of that drugs. Right dose is the key of the treatment in the hospital. When we give a right dose to a patient, the recovery will be good, and the efficacy of the drugs will be good, and the compliance of that patient towards that hospital and that health practitioners also should be positive. And another important right is right road. The road of drug administrations, we have to consider it in the right of the patients. How are we administering the drugs in that patients? Did he need injections or he need tablet? Some patients, they are unconscious, while some patients are conscious. So we need to identify which route we are going to use in giving them that treatment. Another important right is right time. As you all know, right time is very important for every human. In every activities, we have to consider about our time. It is the same in the hospital. We have to consider the right time of taking medicaments, because this is the only way we should know the durations of our treatment and staying in the hospitals. And it will give us a positive results in recovery of our patients. And finally, right healthcare provider. We have to know that healthcare provider is a professional, and he must have a license to work as a healthcare professional. Because when we follow all those 6 right or 5 right, if the healthcare provider is not the right man to be there, all the treatment will not give positive results. So this is just like an introduction to the right observations, because right observations are many. See you in my next video. Don't forget to subscribe my YouTube channel. Thank you so much.